Hey guys, it's Dr. Justin Marcagiani. We're going to bring you a live coronavirus update as well as some context about what's happening in the world, look at the statistics as well as kind of the more conventional approaches and things you can add to help improve your outcome and your health. All right, so let's dive in. I'm going to just give you the data here, guys, in my opinion, based on knowledge guided by experience. Where are we at with these statistics? This is important to look at. So overall mortality rate on the surface appears to be going up. A lot of that is because we don't know the true number of cases, right? Testing will never be able to keep up with the number of cases. It's going to take a year or two after the fact to really figure that out. Numbers or data called regression analysis, these type of statistical analyses have to be done to figure out the total number of cases. So in general, 377,000 cases picked up. Deaths at 11,784. That's a 3.12% mortality. Again, last week we were at 2.41. The X factors are going to be what the asymptomatics are. Okay, we know 10X plus is going to be at this 0.31%. If the 3.12 holds true, that's 3.31%, which is almost 11 times lower than the World Health Organization's estimate at the 3.4% level. And again, we have data supporting some of this, guys. We know 86% on the asymptomatic side. There's data supporting it. Right here, estimate 86% of all infections were undocumented. That means they have the virus, but they have no symptoms. We know that. That's not controversial. Dr. Chavez up in Ontario says it could even be 20x. So we're looking at a much lower number when we actually do the real math. Again, the hysteria math is missing the asymptomatics. And let's apply this to flu, okay? If we have 240,000 confirmed cases of flu a year via lab testing, and then we have 24,000 deaths, which is where we're about now in the season, and about 1.2 million tests were done. We can do regression analysis from this 1.2 million and figure 24 million people actually had the flu, and that would give us a 10% rate if we didn't factor in these numbers. So 10% would be the hysteria math. The real rate, when we factor in the total number of cases based on regression analysis, is 0.12%. That's really, really easy, or really important to keep in the back of your head, all right? So 10% is the hysteria because we're not factoring in the 24 million. We're factoring only the 240,000. 0.1% is factoring in this bigger number based on the regression analysis. So keep that in the back of your head. How do we know that? Well, the CDC gives us data. We know that there's about 24,000 to 63,000 deaths a year of the flu. No one bats an eye at this. We just kind of have accepted that over many, many decades. And again, the numbers I give you on the 24,000, I'm giving you guys the low end. I'm trying not to over hysteriaize this. Try to be more conservative in what I'm recommending. And just hospitalizations alone are about 500,000. We know that based on this data. And that's not seeing a doctor. That's spending a night in the hospital plus maybe ventilator use. Again, hospital visits are over almost 20 million-ish, okay? So that data is coming from real sources. So I just want you guys to kind of understand that and know where that's coming from. Also, a couple things I wanted to highlight that are important is the diagnostic criteria, guys. So part of the big concern here is, let me find this article by the Telegraph. Okay, so this is the Euromomo data. Let's go with the Euromomo stuff. So this is looking at all-cause mortality throughout the world. Well, primarily Europe, okay? So Euromomo.eu is the site to go to. Now, if you look at the red line, that's kind of the average amount of death that you would see at a particular time of the year. And these are all rated by weeks. So you can see this is the 13th week. This was about last week on average. So you kind of can get a perspective at different times of the year where the deaths were. So based on that, you can see for age 0 to 4 in Europe across the board, the overall average amount of death is actually down. We're actually down on deaths. From 5 to 14, the green line, we're below that red line. That's actually down. Look at age 15 to 64. We're actually down on that. Look at age 65. Well, we know that these are the people that are more predispositioned to deal with the flu or deal with corona, right? And that's up a little bit. All ages is up a little bit, but we know that the 65 plus is pulling all the other ages up. How do we know? Because these groups overall are down, down, and down. So we have to assume that this group is pulling the average up. But is this unprecedented here? Is it? Well, no. Look at just last year. It's a bigger blip. Look at 2 years ago. Look at 3 years ago. That's a huge blip. And we've had things like that in the U.S. too. You can see our flu in 2018 was much bigger than 2019 and 20. Just keep that in the back of your head. And then when you look at the overall country data, like I showed you before, almost every country is down except Belgium a little bit in Denmark, a little bit in France, a little bit in Italy. But you can see where Italy's had bumps, they've had bumps in the past. This is not unprecedented if you're just looking at overall all-cause mortality. I mean, Spain's getting hit a little bit hard, but that's nothing than the last 2 or 3 or 4 years and they've seen to begin with. Same with Switzerland, little bump, but look, they've had it before. So nothing we're seeing overall is unprecedented. That's important. And then when you come to the U.S., look at the U.S. deaths per week. We have a drop in U.S. deaths. And that's really interesting because people should still be dying of heart attacks and cancer, right? I mean, some of the decrease could be traffic accidents. People are driving less. Also, iatrogenic causes, not being killed by, surgeons and doctors, which, just done the right way, there's going to be a top 10 cause of death via iatrogenic, which is physician-induced. That happens every year just based on the medical industry. So we know that. And then let's look at the pneumonia death. So pneumonia is also down. So my concern is that the spread between where our average is from previous seasons and now that a lot of these people are getting factored into the coronavirus diagnosis. That's my big concern here. I think you're going to see a lot of those diagnoses get picked up because the diagnosis, if you look at the criteria from the Department of Human Health and Vital Statistics, they are allowing doctors who assume a patient has coronavirus to say that they have coronavirus. Also, we have to develop causality. So we know there's an article over in Italy that I've shown in the past. I want to see if I can hunt that one down. So here's another article by the New York Times here, really interesting. Where have all the heart attacks gone, right? A lot of deaths have dropped, like we mentioned over here. Where are those deaths going? And it talks about some of those variables. That's the heart attack stuff. And we'll go over, I'm going to try to find that article if I can, guys. Okay. This is the Italy one right here. This is important. So when you look at this data, they find that only 12% right here, on reevaluation by the National Health Institute, only 12% of deaths certificates show a direct causality from coronavirus, while 80% of the other patients had one, pre, or 2 or 3 comorbidities. That's another disease. They had diabetes, they had heart disease, they had cancer, and then they got this, and this was the straw that did them in. But only 12% show a direct causality. That's important, all right? If I have a heart attack and I go to the hospital, but I also had coronavirus, what killed me? Was it my heart attack or was it the coronavirus, right? Those are all important things. Someone put a meme online. They said, well, what if I'm driving drunk and I test positive for coronavirus after I get in an accident? Well, what's the cause of death there? Well, how things are being classified now, I think it's very easy to lump cause of death and make more of a correlation diagnosis than a causation diagnosis. And I'm not going on a limb too much because we have data to show only 12% have that direct causality. That's important. Now, we talked about deaths here, right, in the U.S., all U.S. deaths. Well, how does this compare to the past? My concern is this is not what past serious pandemics look like. Let's go look at, for instance, let's see here. Let me hunt this one down for you guys. This one. U.S. mortality, and this is the Spanish flu. So this is the Spanish flu right here. This is 1918. This is all-cause mortality, deaths per 100,000. You had a huge spike here. Okay, you had a huge spike. All right? That is unremarkable. There's no way you're going to miss that. Where's that data here? Where is it? Why aren't we seeing more pneumonia? All right? So my concern is we have some misdiagnoses or we just have some correlation over causation issues, and some of these deaths here that are dropping out down here are getting lumped in. And we know that based on Italy. We know that based on other countries. So that's kind of my general supposition. Now, where are we heading? Just to give you some data on that. I've taken a new approach the last week, so I'm just trying to compare us to Italy because Italy kind of got hit the hardest. So then we don't have, before I was using more of the Chinese data as a comparison, but I think that data is suspect. So we're going to use more of Italy's data because it's kind of the worst case scenario. And so what I did, kind of common sense here, I just looked at when Italy started having their mortalities and I compared it to the US starting their mortality. So you can see about March 1st here on the deaths. And then you can see about March 14th, 15th. So about a 2-week gap or so. And again, it's about a 2 to 3 week progression for the coronavirus disease. So that means if someone gets coronavirus they may die 2 to 3 weeks later. So where they get it and where they die, there's a lag time. And so, of course, the healthier you are, the longer that lag time is going to go. So Italy has an older population, more unhealthy, a lot of respiratory issues because of smoking and pollution and such. They may not last as long. So everything may not be apples for apples because the kind of patients that are having it may live longer or less. So the curve may be off by a little bit. But when you look at the data here, you can see this is where it starts. This is the apex of the curve that Italy hit, which was about March 26th to 27th to 28th, right in that area here. And then if you compare it to us, we're about 5 days away. So this green line represents the gap of where we're at now to then. And then I basically extended it backwards so you can see how many days that encompassed. 1, 2, 3, 4, about 5 days. So that would put us at the apex at about April 12th, just to give you guys that data. And if we look at Dr. Murray's data over at University of Washington, he's thinking the peak will be April 15th. That's hospital resources. But if you look at deaths, he's thinking at about, he's thinking April 16th now, 9 days until peak, April 16th. So again, that's their data. Again, the experts have been fabulously wrong in this. If you recall California's estimates, California was estimating 25 million people to get the coronavirus, 500,000 deaths. If we just look at California alone, we are not even seeing close to that. Let's just look at total deaths right now. I'm just curious. And let's look at California. And then we're at 387 deaths total, okay? And just so you know, 700 people die a day in California. 2 out of those 700 are coronavirus. So you can see the estimates have been fabulously wrong across the board. So we'll just kind of keep that in the back of our mind. We always want to compare. We want to have a relative example of other countries. We want to look at the all-cause mortality here. And I want to compare us to other countries so you guys can get a sense of what's happening. So this is kind of my general recommendation. Probably April 12th, April 13th will be where that apex is. Dr. Murray over here is saying it'll be the, like I mentioned here, April 16th. So we'll see. Plus or minus 3 or 4 days. Keep that in the back of your mind, guys, and this will get better. Now let's look at what other countries are doing so you guys can see it. And also, we're doing really good when you look at deaths per 1 million. This is the number you want to look at so we can have a relative analysis. So 283 here with Italy. United States is way... Did I miss them? Did I miss them? Where's U.S.? U.S. is here. 36, okay? So 36, and then we have Italy at 283. So if we do the math on that real quick, we just do 283 divided by 36. So we're at about 7 to 8, about 8x difference on that, which is really good. And again, testing is going to skew it, right? This isn't even that accurate, but it gives you a good relative idea. Now let's look at countries that didn't close down their borders, okay? There's a couple countries that didn't close down their borders. Let's look at Sweden. Sweden's at 59. So remember, they didn't close down their economy. They had a strategic shutdown, old, immunocompromised, stay in, young, healthy, go to work, right? So they're still not doing bad, relatively speaking. Let's go look at Denmark. They didn't close down their economy. They're at 35. They're actually 1 better than us. That's pretty good. Let's also go look at Brazil. Brazil didn't close down their country. That was the president there is Bolsonaro. I saw an article that he was touting that he wasn't closing down the economy. Where is Brazil? Man, are they even here? Let's do a control F and see if we can find them. All right, and so Brazil, total deaths per 1 million, 3. So I don't know, guys. I mean, I'm concerned about a lot of the deaths and despair and mom-pop businesses that will be closed because of this economy compared to countries that didn't. So I think there'll be some interesting conversations and debates when all the data comes through and we have countries that didn't do the same things we did and we compare that data. I think this may seem like a total overreaction and maybe protocols will be changed in the future. I'm just not seeing the data support what we're doing based on other countries that didn't do what we're doing. I mean, this disease is going to progress. And of course, you know, the whole curve thing is helpful because we can flatten the curve, which we have. We're not even close. Like if you look at New York, this is really interesting. We're not even close to hitting max capacity in New York. Let me show you this. So you can go and do state, and then let's go do New York. Let me see here. So we did United States. I should be able to do states in here. There it goes. Okay, good. So now let's go New York because New York's the hardest hit, right? And then this is hospital resources. So this is our resource count. And these are all available beds right here. Okay, and this is all available ICU beds. So you can see right here, here's our projection of where we're at now. This is all beds needed. So you can see we're still within, this is our limit up here. Okay, this is our limit for all resources. So we're still way within our limits on this curve. Let's look at all beds. This is beds. Let's look at ICU beds. So we're still when we go outside of this curve here, this shadow, this is where we're going to be having problems, right? So we're still within our needs for beds, for ICU beds. And let's look at invasive ventilators. So I'm not seeing any problem here within what our needs are compared to what the projection is so far. And I'm just using New York because New York's the hardest hit, right? There are some other states that were hit hard, but nowhere near as New York. So I'm making an assumption that if New York's good, then everywhere else is. Let's go look at, and again, of course, New York has a surplus of 4,000 other ventilators that are in storage, so we'll have to keep an eye on that. Let's just look at Louisiana real quick. Same kind of thing. So invasive ventilators, we're fine there. ICU beds were fine. All beds, fine. All resources, fine. I mean, we're looking good. Let's go look at the U.S. again. Let's go look at the U.S. from that perspective again. I mean, I just want to bring you guys some comfort here today. I mean, you guys should feel good looking at this data. Look at all resources for the U.S. We're fine. Look at beds. We're fine. Look at ICU beds. We're fine. Look at invasive ventilators. This is what people are scared of. We're fine. Look at this surplus. I mean, we're at here. Let's just say that's 25,000, right? We got to spread almost up to 50,000. That is awesome. Now, it just shows you that people, I think, went overboard in some of these projections. Let's look at some of the countries here real quick. United States. Let's look at some of the graph data. I kind of already showed it to you already, so you can see cases are dropping, which is great. And then you can see, I think we're almost at the bell curve based on where I think we're going to be here. All right, we're almost there, 3 to 5 days. You could see Denmark, like we talked about Denmark, because they didn't close down their economy. You could see new cases are flatlining there. And then you can see deaths are on that downward projection. We'll see if that continues to flow. Brazil, again, I'm looking at them because they did not close down their economy. Daily new cases are stabilizing and dropping. We'll see if it continues to hold. And then again, you can see overall deaths are definitely at least flatline and or dropping. So we'll have to just get more data on that. We already reviewed the U.S. Italy, again, this is the worst case, guys. Look, they're already heading down. Cases are totally dropping. You can see that trend there. That's quite apparent. It's consistent. And then look at the overall deaths. It's right there. This is the projection. This is the path that we're going to follow as well. You're going to see Spain here as well. Same kind of thing. Cases are flatlining and dropping right there. You can see that trend. And then you can see deaths as well. They're dropping. This is a predictable pattern. I think what people are thinking is this is going to go on forever. There's multiple waves. No, we're not seeing that. Here's the daily deaths in South Korea. That's dropping. That trend is dropping. Here's the overall cases. You can see that's dropping and flatline. So we have a lot of good data coming your way, guys. A lot of good stuff. I'll do another video later on here on some other topics of it. I'll cut this one short because we went over a lot of data here today. I hope you guys are enjoying the updates and kind of get a sense of where we're at. There's good things to come. We're moving in the right path. 5-6 days, I think we'll be at peak. Dr. Murray says April 15th, 16th. You can see ventilators, hospital beds. We have enough. We're looking good. We're on the right track. Projections were about 5 to 8 times off, way off. So we're in a good place. And I hope you guys enjoy the content. If you do, put comments down below. If you enjoy it, let me know what you think about it. And if you enjoy it, give me a thumbs up, subscribe, hit the bell for notifications on future content. All right, thanks, guys. You have a good one. Take care. Bye.